Hi, I am Diana, Communications Assistant for the City of Enid, and special guest with me is Sara Gorman, County Director for Garfield, Grant, Blaine, and Kingfisher. Sara, thank you for joining us.
Thanks for having me.
Okay, Sara, so we're going to jump right into these questions. How has COVID-19 affected Garfield County DHS?
Well, back in mid-March, we started implementing a process to get most of our staff working from home. So it took a little bit of time to get everybody where they could, but we closed our doors to our offices at that time as well. So currently, DHS is still open, but our office is closed to the public. But we have our website is operational, and our phone, we still have people manning the phones at the office. And so if people call or have questions, we're still there to assist them, and they'll just get transferred to a worker who is working from home, and we'll be able to assist them that way.
Now, DHS offers many ways of assistance. Now, one of them is childcare. Can you tell me a little bit about that?
Right. So generally, in order to qualify for child care assistance, you have to be either working or going to school. You have to meet a need factor for it. But we just received notification this week that starting May 1st, if you've lost your job due to the COVID-19 pandemic, then you can qualify to receive 60 days of job search childcare. So if you've lost a job and now that everything's starting to reopen and you need childcare assistance to look for and apply for jobs, then that's available for 60 days. So they can use daycare as much as they need to during that time. And there's no income guidelines during that time as well. And then also for the months of April and May, generally based on your income and the household size, you would have a copayment that you'd be responsible for paying, and they have waived those copays for the month of April and May.
Thank you for that information. That is very useful information for a lot of parents at this time. Now, DHS also offers food assistance like SNAP, also known as food stamps. Can you tell me a little bit more about that?
Right. So it's a program that we have. It is formerly known as food stamps, and it's now called SNAP, Supplemental Nutrition Assistance Program. So everybody who was already receiving food stamps during this time, due to the COVID-19 pandemic, we received funding and were able to supplement households for the months of March and April. So if they got supplemented up to the maximum amount that a person can receive. So the food stamp amounts are prorated based on income and household size. So if you did not receive the maximum amount of benefits, then you got a supplement up to that amount. If your household already received the maximum amount, then no more were issued to them. But they've had several other different waivers out there that we've been able to implement, more just specific policy stuff. We have a policy, for example, that's called able-bodied adults without dependents. So if you're in between the ages of 18 and 50, generally you can only get 3 months of food stamps, and then you have to be doing some sort of work in order to qualify for more. So they waived that policy for the month of April. So you would get certified for 6 months until your review come up. So there's been several different waivers like that for the food stamp policy.
Great. Now, you guys also help with utility assistance. Can you tell me more about that?
Sure. We offer a program. It's called LIHEAP. It usually runs once in the summer and once during the winter time, and that's just open for anybody to apply for. And then we have a program which is an emergency assistance program. It started back in March, and then it runs once during the winter time as well, or summer, sorry, late summer. So that program, you have to have a cutoff notice in order to qualify for it. and it started March 17th. But with most of the utility companies not doing cutoffs right now, most of the people who had applied got denied their applications because they weren't going to get cut off. But they have since just recently changed that. And so if you do have a cutoff from your utility provider for either heating or cooling, then you can apply for it. The amount that we pay for that program, they have changed it to where everybody's going to get the maximum amount on that as well, which is $500. So if you qualify income-wise and you have a cutoff notice, then there'll be a $500 payment issued to the utility company.
Wow, that's great. I know for a lot of people that are struggling, that is going to be some useful information. Now, DHS also has services with persons with disabilities and who are aging. Can you tell me more about that?
Sure. The DDSD office, which is for developmentally disabled, their office is actually over on Overland Trail. So their office is separate from the main DHS office, but
Okay.
They serve intellectually and developmentally disabled individuals. They have 3 different waiver programs that a person may be eligible to receive. So their office is closed at this time as well, but they have their phones operational as well. So if you have questions, you can call in. And then for the aging population, we have programs. There's the Advantage Waiver and Personal Care Program, which is programs to help keep individuals out of the nursing home. So it provides in-home services like housekeeping, bathing, some cooking, running errands, stuff like that. And then we offer nursing home assistance. So if an individual is needing that level of care, then they can apply to see if they're eligible for us to assist them with paying for their nursing home care. We also have Adult Protective Services is housed in our office. So they assist individuals, they get referrals for people who feel that somebody is being neglected or exploited, abuse, anything like that. So they're housed in the DHS office as well. So if you have concerns for an elderly person, or it's really anybody 18 or older, that's who they would need to get a hold of, was Adult Protective Services to make a referral.
Thank you, Sarah, for that information. Now, the DHS also handles applications and eligibility for SoonerCare, which is the state's Medicaid program. Can you tell me a little bit more about that? Sure.
So we do offer the SoonerCare program for most children and pregnant individuals. They actually is ran by the Oklahoma Healthcare Authority, and they have their own website. It's mysoonercare.org that an individual would go to apply for services. But if an individual is aged, blind, or disabled, so aged being over age 65, blind or disabled, that's determined by Social Security standards, then they would apply at the local DHS office for the programs that we have. So they can also apply at OKDHSLive, live.org for any of our benefits as well. And they also, because of the COVID-19, we received a waiver where any medical that was set to close, we're not closing at this time. So the medical's remaining open so that if the need arises, it's there for them. So if they forgot to do their review, or we got their review and then it put them over income, we're not able to close them at this time due to that. So that's a good service that has come out of this for now.
Indeed, that is. Now, even though the DHS is open. They have their doors closed in the building. Is there a soft reopening plan for the building to reopen their doors?
At this time, we have not been given an official date yet on when we're going to reopen our doors. I know the discussions are being had up at the higher levels, and working out plans for it. But right now, our main concern is keeping our staff well and healthy, and then keeping our clients that come in as well, reducing the possibility of spreading it. So we've learned that we are able to assist our clients while working from home. So I think it will still be a little while before we open our doors. There's 100 staff out there at DHS, and we've cut it down to where only 3 are regularly in the office. So, we've, like I said, made ways to make it work and still assist our clients. Our applications have more than doubled the amount of applications that were taken a day. So I need my staff to stay well so that they can process all these applications and get the benefits to the people who really need it. So, like I said, I know they're working on it, but I think it will be a little while still.
Now, for viewers who are watching from home and want to apply for assistance, how would they go about applying for assistance?
Well, we would really like everybody to go to our website, it's okdhslive.org. That has all the programs that you can apply for. So you would sign in. You sign in with an email. You create an account if you haven't created one. And then you would apply for the benefits there. There's also some, like a food stamp calculator. So if you're not sure if your household would qualify income-wise, you can put all your information in there, and it will tell you right then and there if you would qualify. So if you're having problems with the website, you can always call our main switchboard number. It's 548-2100. I only have one person manning that phone, and our phone calls have increased at this time. So just be a little patient with the phone if it keeps ringing for a while. Don't give up on us. Somebody will answer it, and they will transfer you to a worker that can assist you with applying if you're having issues. So.
Thank you. Now, for any updates that DHS gives out, what are the ways that viewers can stay updated with those?
We do have a Facebook page. It's the whole state of Oklahoma's Facebook page. It's not specific to Garfield County, but it's Oklahoma Human Services. So they have Facebook and Twitter accounts. Any big announcements, DHS does put out press releases. So it'll be on the news and that sort of stuff. Or if they have specific questions, they can just call. We're always there to answer any questions that they may have.
Thank you. And I don't have any online questions. Is there something you want to share with us, Sara, before we close out?
I just want to reassure that we are there to assist people, even though our doors are closed. That's what we're here for, is to assist them. So if you come out to the office, you can't get in the doors, there's signs posted on the doors stating phone numbers that they can call to reach us. I want to give a shout out to my staff. They've been amazing throughout processing double the amount of applications that they have, and our processing time still hasn't increased very much. So I appreciate my staff working super hard to serve our communities and get the benefits to our clients. A few other resource needs. We refer people to 211, the phone number that people can call if they need help with different resources. That's a resource hotline number. I think that's about it.
Well, thank you, Sarah, for being on with us and sharing all the information that you have to our viewers.
Absolutely. I appreciate you having me on.
And thank you also to all the workers at DHS. I know that most 99% are working remotely, and so for DHS to do a different way of serving the community and being efficient at it it is great for our community. So thank you, DHS, for what you are doing, and also thank you, viewers, for watching. Join us tomorrow for another COVID-19 live update where we will be meeting with Brad and Tammy Mendenhall at World Harvest Church talk about how they have a strategy in place for soft reopening for the first phase of Mayor Pankinen's reopening the Enid's economy. Thank you.